Hey everyone, today you are going to learn about the skeletal system. So, just some fun facts that there are 206 bones in adults, and there are actually more in children because the bones fuse. Some functions that you should write down are that they support, so body structure and shape. If you can imagine your body without bones, it would look pretty funny, look like a slug. Protection, so some of the bones surround vital organs. Movement and anchorage of muscles. So two things that you need to know are tendons attach muscle to bone and ligaments attach bone to bone. The way I remember this is the Achilles tendon, which is on your calf muscle and it attaches to the heel bone. So that's a tendon. And then like some people tear their ACLs or something like that, and that's anterior cruciate ligament, and so that's a bone to bone thing in the knee. Some other functions of the skeletal system is mineral storage, so calcium and phosphorus. Those are used in other reactions in the body like muscle contraction. And then this is where our blood cells are made, um, red and white, and that's called hematopoiesis. And bones are reshaped throughout your life depending on what your activity is. And actually, interestingly enough, 10% of your bone mass is removed and replaced every year. So bones have a specific composition. So the main thing that makes up bones is what's called collagen. Vitamin D, we've talked about this a little bit, it's really important for um, calcium to be absorbed into your body. So when you drink milk, you want to check and make sure it's vitamin D fortified. And calcium absorption increases with estrogen, testosterone, and activity, like exercise. And then calcium absorption decreases with no hormones and less activity. So when women go through menopause, it's important that they keep up their calcium and vitamin D levels. The periosteum, peri means around and ost means bone. The periosteum is a fibrous covering of the bone, and it contains blood vessels and nutrients and oxygen and gets rid of waste. What I always think of is like if you eat ribs and there's that little thin part right along the outside of the bones, it's kind of tough. That's the periosteum that you're eating. And there's some cells that you need to know. Osteocytes, so again, osteo means bone and cyte means cell. So those are mature bone cells. And then you've got osteoblasts, which build bone, and osteoclasts, which break bone down. And so when you have something called osteoporosis, it means that you have excessive activity of these osteoclasts. So this is just a picture of osteoblasts here. Those are the builders, and they're secreting, proteins and stuff into the matrix. And then osteoclasts are actually secreting acids and enzymes to break bone down. So bones are also described in terms of their composition. So you've got compact bone and spongy bone. And this is a great picture. The compact bone is the stuff, and you can imagine it's much stronger, and the spongy bones are at the ends. So it's dense and stress bearing. Spongy bone is low stress because it's not going to be able to take a lot of stress if there's a lot of holes. And at the ends of long bones and your ribs, your hips, your vertebrae, and your cranium are all spongy bone. So here's just another picture. You can tell spongy bone versus the compact bone. And as you go down, this is a picture of the femur. As you go down, there's more and more compact bone to take that stress. Okay, so bones are also categorized in terms of their shape. So there are long bones, which are like levers. And those are some tricky words. This is called the epiphysis, and that's the ends of long bones. So that would be this part, the epiphysis, and then the diaphysis, which is the long part of the long bone. And so the epiphysis is where you have bone to bone, and so you need to cover it with cartilage. The diaphysis is, again, where most of the bone marrow is, and so it contains red and yellow. And the periosteum is the thin layer of connective tissue around it. And the diaphysis is usually made mostly of compact bone. And some examples would be the femur, the tibia, and the fibula. Short bones, just like they said, are short. And they are little cubes. They're for flexible movement. They're usually spongy. They don't take a lot of stress. And an example would be your carpals and your tarsals. So the bones in your ankles and the bones in your wrists. And then sesamoid bones are a type of short bone. And the one I always remember is the patella. So it is a bone, right? Your patella of your knee, and it's surrounded by tendons. And remember, tendons are bone to muscle. So it holds your femur. Your femur is right there, and it holds like part of your quadriceps. Okay. Then there's also flat bones, and just like they sound, they are flat, and they protect vital organs, and they have a lot of area for muscle attachment. So your cranial bones, right? Your facial bones, your scapula, right? And here's an example. So they're not very strong. They have lots of spongy bone in them, but that's not their point. Is to be strong. They're to be there to protect in a flat way. And irregular bones, their function is flexibility, and some examples are the vertebrae, the ribs, the ear, and the hip. And then the hyoid bone is really interesting. It's the bone that attaches to your tongue, and it is the only bone in the body that doesn't articulate with another bone. And what that means is that that bone doesn't like go up against another bone. It just sits there and holds your tongue. Um, so, fun fact. Okay, so how do bones form and grow? So when you are a wee little thing, you are made of cartilage. And until the second month in your development, and then your skeleton ossifies. And ossification is just the formation of bone. So your cartilaginous skeleton turns into bone, and that happens by the 8th week. So the fontanelles, I'm sure you've heard of as soft spots, and those are in the skull of a baby, and they fuse later. And the function of this is so that the head can fit through the birth canal, because it's a um, small little area. And so this is just a picture to give you an idea of what happens to the cervix in order for the baby's head and body to come out. So in childhood and adolescence, so your teenage years, the osteoblasts, or the ones that are building bone, are working much more than the breaking down bone, because you're growing and your bones are getting harder and more solid. In early adulthood, they're working about equally. And then after 45 or older, the osteoclasts tend to work more, and so that's when people have to keep putting pressure on their bones so that the osteoblasts will work. All right, so bones can grow in a couple ways. They can increase in length at the epiphyseal plate, or you might have, doctor might have talked about your growth plate. Some people, if they break a growth plate, like there's a growth plate right here, and if they break that when they're still growing, it turns into bone and it doesn't grow anymore. And so your arms could actually be different lengths, or your feet, your legs, I'm sorry, could be different lengths. So that's the epiphyseal plate. That's the growth plate. That's how they increase in length. And then in width, what happens is you just get bone that gets, more and more around it. And that's controlled by what's called the growth hormone in the anterior pituitary gland. So some issues that can happen are dwarfism, and that would be hypo, which means low function of this growth hormone, so you're not getting enough of it, or giantism, which would be hyperfunction, meaning you have too much growth hormone. And then this is a disorder where you have hyperfunction after puberty. So, right, you're growing until you are done with puberty. Well, this disorder causes you to grow after puberty, and so it gets you, you put bone on top, and so you get big, thick bones. And Andre the Giant was an example of somebody who had this disorder. And then here is a picture of, giantism versus a average sized person, and then this is dwarfism. Okay, so bone marrow. You have yellow and you have red. So if you look at the yellow, right, it's going to be in the middle of all your long bones. And the function there is fat storage. And red marrow is in your spongy bone, and that's mainly in your vertebrae and your hips and your skull and your ribs. And the red marrow is where you form red blood cells and platelets and white blood cells. And that's, if you hear people getting bone marrow transplants, it's from their red marrow. And really where they get it is they go into the hips. So you can get your bone marrow tested and get on the list for people who have like leukemia, who need a bone marrow transplant. And what they do is, if you were to donate your bone marrow to me, um, if I had leukemia, what would happen is they would go in there and they would basically destroy all of my bone marrow because it's cancerous, right? And so then they would stick, if you were a match and you had, similar flags on the outside of your cells, then they would insert some of your bone marrow into my bones, and then my bones that would cause them to recreate your bone marrow in me. So some diseases and conditions that can happen with your bones. Kyphosis is like this one, hunchback. Okay, lordosis is swayback, like this. We all have we all have some curve in our spine, but not a huge one. Scoliosis, which is lateral curvature of the spine, which I'll show you in the next slide. And then arthritis, which is where your bones, where the joints are, the cartilage is disintegrating as you get older because of the constant rubbing. And so that can be it. You might have heard of bunions, and that's where you have extra bone going on the big toe. And then, osteoporosis, that's when you get more brittle bones as you get older. That's when the osteoclasts are working extra hard, and you're not getting enough calcium and low mineral content, and then it's easier to fracture those bones. So this is a picture of a student that I had. So this was her spine before, and as you can see, she looked a little off in her posture, but not as much. So somebody with scoliosis, if it's not like horrible, you might not even be able to tell because they adjust their body. So this was before, and then this was after. She got some rods placed in to straighten up her spine. People can also need to wear braces around their torso to help straighten up their spine. This was a pretty severe case of scoliosis, but it's the lateral curvature. It's not, it's like to the side like an S. And then here's just some other pictures of kyphosis and lordosis, and then here's another picture of scoliosis and a bunion. And then here is somebody's bones who have osteoporosis. You can see that there's big holes in there, not very strong, versus somebody who has normal. And that's it. So hopefully you took notes on the skeletal system, and have a great day.